Chapter 8, Anatomy Trains. The fourth way your back breaks. Ryan had a lot of loves in his life, but the greatest of them all was golf. Currently, he was 64 years of age, and he said the first time he swung a club was when he was 7. For the last 30 years, he had back pain on the left side, which was now starting to limit the amount of times he could play. Being retired meant something different to him than that, so as other options failed to produce results, he was introduced to me by a friend. As we talked during our first session together, it came up that he can also barely turn his head to the left. When we look at golf, the first thing we see is it is a rotational sport. Being right-handed, you will twist right, swing using the left side of the back, and the next time you watch golf, watch their head after the follow-through. They are always crooked while watching the ball. Spend 40 years doing this, and you can already see where I'm going. When Ryan told me about the neck tightness, I knew I had an anatomy train issue going on. As we worked on his left side neck, he started to notice that the pain in his left side back was changing. There was a buzzing/warm feeling as the fascia was unfurling itself and blood was being introduced to dry tissue. We also had to work in the same hamstring and same calf. This is called the superficial back line. Anatomy Trains was developed by Thomas Myers, who did more than 60 dissections on cadavers, slicing tissue after tissue away to find that there are certain sets of muscles in the human body that are directly connected via fascia and tendon, in some cases from head to toe. These are two trains that love to produce back pain. Looking at figure A, we see the fascia descends pulling toward the heel, causing back pain. In figure B, it's the outer leg and glute that will stress out the opposite back. The first time I ever worked an anatomy train line was with a ballerina dancer who was having serious hip issues. Nothing I was doing was releasing her hip. It was about 2 or 3 sessions, actually. I kept thinking and meditating on the issue. I remembered reading about the lateral line in anatomy trains. I looked it up in the book and worked on every muscle Myers showed was connected. And what do you know? The hip finally released. This is what keeps other practitioners guessing and makes back pain a $100 billion industry. The body can be very tricky, very, very tricky at times, and you need to use many different techniques in order to figure out how the fascia tied itself up. If you go to an acupuncturist and your body doesn't respond, you now just flushed the money for that session down the drain because the acupuncturist can only offer you acupuncture. As silly as it sounds, I may use 3 different techniques just to release a painful wrist. Every body is not the same, does not respond to the same pressure, and in the case of back pain, as you can see, you need to identify the problem before you can work toward a solution. In this case, there are 2 anatomy trains associated with back pain. Read on to see if this is the case with you. Train number 1, the superficial back line. If you studied this photograph closely enough, it shows how the body, your body, has a fascial connection from the bottom of your feet to the top of your head. What does this mean from a pain standpoint? It means that foot pain can be connected to back pain. So can neck pain, calf pain, and hamstring pain. Pull a hamstring playing ball in college? Most people do. Back pain develops in 40 years? Connected? Yep. Maybe you ran track and tore a calf muscle or developed compartment syndrome training too hard. That's okay because you allegedly recovered by taking a couple months off. The problem is you never tended to the muscle tissue or fascia of that calf. It remained glued down, a literal anchor point for the superficial back line. And as you're enjoying your yoga class, you notice how your left hamstring is tighter. And one day while doing downward dog, you hear a loud pop in the left side of your back. Nobody would ever make the connection to the calf was the problem, right? Hopefully by now you are learning to not treat the symptoms. To open up fascial lines is long, tedious work, but can be done by anyone serious enough about getting out of pain. As you can see in this case, we literally have to work from your foot to your head on the affected side. I generally will start from top to bottom, but many of my clients have started from the ground up and have gotten great results. The order apparently does not matter to the fascia. The important part is that you need to hit every muscle during every session. So when we're looking at anatomy trains, we are still using the principles of fascia. Yes. Okay. The entire body is connected. The entire body is connected. That fact is never going to change. But what we have is pieces that are also working together independently of what fascia is doing. And this is the case in anatomy trains. So I implore you to Google this so you can look at pictures, all right? Especially the pictures that Thomas Myers has of him actually holding these fascial lines in the body in a cadaver. Okay, they're fascinating. But really, what it comes down to is that all muscle is connected to tendon. Tendon then connects to the bone. And what he found is, let's say, the tendons that are connected to the muscle on the bottom of the foot, the tendon is going to wrap around that heel. It's going to attach to the heel. That same tendon then goes right into the calf muscle. Okay, so you have the tendon stop right here, and then the calf muscle starts. It goes up the leg. So technically, the bottom of the foot and that calf muscle, they're all one. Okay, so a lot of times we can create movement patterns, or even heck, just, sitting like this. It's not a, it is a movement pattern, but it's not. Sitting here like this, my hips are at 90 degrees, my knees are at 90 degrees, my feet are at 90 degrees. Everything gets locked into that position if I sit here long enough, year after year after year after year. Now, what happens when I go to a CrossFit class, let's say, and I have to squat all the way down to the ground? This doesn't work. Okay. My flexibility is really poor because my body has said we've been in limited positions for such a long period of time. I'm going to stiffen everything up to be efficient. So this is how anatomy trains in our body end up creating problems. They get tight, and it's a multitude of things instead of just one or two things. Step number 1, scrape. For this mobilization, you are going to take the back buddy and massage the back of your skull from side to side. Do this with a large round ball on the middle of the shaft. Rub lightly for 1 to 2 minutes, take a 30-second break, then rub again for another minute or so. The first time I did this, I could not believe how sore my scalp was the next day. Same with my clients. The stress to carry a 10-pound head all of your life is obviously exceptional. Your head should feel light and airy after you are done. Step number 2, release the neck. To do this mobilization, you are going to use the round ball at the end of the small hook to pin down the same side of the neck your back pain is on. When you are going to bend your neck the opposite way. Shown below would be for right side back pain. Start from the base of the skull and work your way down to the bottom of the neck. Pin down, tilt, move an inch lower. Pin down, tilt, move an inch lower. Got it? Good. Step 3, work the rhomboid and erectors. This mobilization is for everybody on Earth. Not only do we store a lot of stress in this area, but it just seems to be a major intersection for pain. You can do this mobilization in 2 different ways. They each work, but the second one works a little better. The first way is to use the sharp point on the large hook of the back buddy. You're going to pull the hook away from your body and dig it into your rhomboid the entire length of your shoulder blade. The second way to loosen this line up is actually what I prefer because you can hit the entire line from your neck all the way down to your lower back. It is both simple and effective, but also can be very painful because of its effectiveness if you have serious tightness in this area. I suggest starting off up against the wall when transitioning to the floor when the wall gets easier. To start, put a lacrosse ball between your shoulder blades up against the wall. Now lean back and roll up and down between your shoulder blade and your spine. Roll the entire length of the shoulder blade for approximately 2 to 3 minutes. Step number 4, glute, ham, calf, and foot release. Even though the glute is not part of the superficial back line, I always hit it just for good measure. Then I'll work the hamstring. You can do both of these like I showed in the trigger point section. The calf is super easy. You just have to make sure when you are mobilizing it, your leg is up on a box or thick book so your foot is off the floor. Use a lacrosse ball and roll from your knee to your foot, making sure the foot is limp. If you do not relax the foot, you will not release the fascia. 2 to 3 minutes of pressure is ideal. Lastly, stand up and roll the ball aggressively on the bottom of your foot by stepping on it and rolling back and forth. Line number 2, the functional back line. The back functional line should be very familiar to you by now. This is because it is the X pattern I spoke about earlier in the book, with one exception. The main culprit in the X pattern is the glute, while the main culprit in the back functional line is the vastus lateralis, which is a quad muscle. Read that again for me, please, and let that sink in deep. Your back may be hurting because the outside of your leg has tightness in it. The first time I encountered this problem was with a young kid who taught scuba diving for a living. One day, while working, one of the customers was trying to help him unload the boat and swung one of the tanks around too quick, hitting him in the outside of his leg, giving him a massive Charlie horse. He thought nothing of it because who hasn't had a Charlie horse before, right? The first 2 sessions I had with him were very frustrating. I worked the glutes, the hamstrings, the lower back. I made sure he was in alignment perfectly. We stretched the hips next, and that's when I found the fascial restriction. His right leg had about half the external rotation of his left leg. So I started up and down the right leg, and that's when I found a brick-like adhesion halfway down in the vastus lateralis. As I applied pressure, the pain was radiating intensely into his left lower back where he was having the symptoms. Even though I have only found this in 3 people so far, it had to be included here. I marveled at how the body works and still do every day. I mean, would you or would you not throw punch me if you came to me with excruciating lower back pain and with my honest, most serious face told you it was your leg that was the problem, not your back? But I digress. Step number 1, loosen the entire glute first. Hit the glute medius, glute minimus, and glute maximus for 2 minutes each with a lacrosse ball as I showed in earlier sections. Pay attention when on the minimus to see if there is pain radiating down the leg into the quad. Step 2, rake the outside of your leg. Funny thing about foam rollers, they don't come with instructions. Watching people roll on rollers without a care in the world while on their phone or talking to friends is not the point of breaking up the myofascia. Raking is a slow, methodical, active mobilizing or a tissue or group of tissues. For more information, see my video on YouTube titled Raking Tissue with an M80 Roller. To do this mobilization, you are going to start at the hip and lay on the roller. You are then going to slowly roll the fascia down your knee, then return quickly back to your hip. Repeat the process for 2 to 3 minutes, stopping if you hit any lumps, bumps, or painful areas. Here's a direct link to the video. It's on YouTube. Lastly, as the adhesion starts to break up, the foam roller will become obsolete. At that point, you will want to switch over to using a softball. Same principles apply. Rake the tissue slowly on the way down, then return up quickly. Same 2 to 3 minutes. Try not to sweat. It's going to be painful. You got to love it and breathe through it. Step number 3, roll the symptomatic side of the back. The last part of this is to roll on the symptomatic side of the back from the hip up onto the lat, right underneath your armpit. To do this, simply lay down on the roller, then lean to the symptom side a little and start to roll slowly up and down, kneading the massaging the fascia. 3 to 4 minutes will do the trick, and in some cases, you can spend up to 6 minutes caressing the area. Conclusion: anatomy trains are tough customers because you are working with a lot of tissue in the body. Stick with the principles I laid out, be consistent, and listen to your body. It knows best. In the next chapter, we are going to learn about the King Kong of all back problems. As usual, back pain is not the problem, but the symptom of our body being a yes man. So, there you have it. That was a little bit of a shorter chapter, still just as important as the others. So what I would like to do right now, since we have a little bit more time than some of the other videos, is really invite you to email me, rebuildingyou@proton.me, if you are having any of these issues with your back or anywhere else in your body. Okay. I'd love to be able to hop on one-to-one with you in order to figure out what is ailing you, and then hopefully invite you to my program if you would like to become a permanent member. All right. Love, light, and aloha. And thank you for being here.